Welcome day. We're diving into a less common, but significant heart condition, nonbacterial thrombotic endocarditis, or NBTE. It's a mouthful, I know, but understanding it is crucial, especially for those with underlying health conditions. Join us as we explore what NBTE is, what causes it, and how it's managed. So, what causes this condition? Unlike typical endocarditis, which is caused by bacteria, NBTE arises from sterile thrombi, or blood clots, forming on the heart valves. These clots aren't infected. Instead, NBTE is often linked to underlying systemic diseases like advanced cancers, autoimmune disorders such as lupus, or hypercoagulable states where the blood is more prone to clotting. Sepsis can also contribute, even in the absence of direct bacterial infection of the heart valves. Basically, NBTE indicates there's a larger problem going on in the body that's affecting the heart. Let's look at how NBTE actually develops. The process starts with damage to the heart valve surface. This damage could be from inflammation, injury, or even just the wear and tear of everyday life. This damage then exposes collagen, which attracts platelets and triggers the coagulation cascade, leading to the formation of these sterile thrombi. These thrombi, being relatively fragile, can easily break off and travel through the bloodstream as emboli, potentially causing strokes, kidney damage, or other serious complications. While precise numbers are hard to come by, NBTE is considered relatively rare. It's challenging to get accurate epidemiological data because NBTE often is undiagnosed until autopsy or is found incidentally during imaging for other conditions. It's more common in individuals with advanced malignancies, particularly adenocarcinomas, and in those with autoimmune diseases. Risk also increases with conditions that predispose to hypercoagulability. The signs and symptoms of NBTE are often nonspecific and overlap with those of the underlying condition that's causing it. Patients might experience stroke-like symptoms, such as weakness or numbness on one side of the body, difficulty speaking, or vision changes. Other signs include signs of kidney damage like blood in the urine or swelling. Fever may or may not be present, distinguishing it from infectious endocarditis. Because the symptoms are varied, a high degree of suspicion is needed in at-risk individuals. Diagnosing NBTE can be tricky. Echocardiography, particularly transesophageal echocardiography, is the main imaging modality used to visualize the vegetations on the heart valves. However, distinguishing NBTE from infectious endocarditis can be difficult based on imaging alone. Blood cultures will be negative in NBTE, unlike infectious endocarditis. Ultimately, a combination of clinical history, imaging findings, and exclusion of infection are crucial for making the diagnosis. In some cases, pathological examination of a removed vegetation may be necessary for definitive confirmation. NBTE doesn't have distinct subtypes. Its classification is primarily based on the underlying cause, such as malignancy-associated NBTE or autoimmune-associated NBTE. Understanding the root cause is critical for tailoring treatment strategies. The primary goal of treatment for NBTE is to address the underlying condition. Anticoagulation, typically with heparin or warfarin, is often used to prevent their thrombus formation and reduce the risk of embolization. However, the use of anticoagulation needs to be carefully considered, as it can increase the risk of bleeding, especially in patients with underlying malignancies. In some cases, surgical removal of large vegetations may be necessary to prevent life-threatening embolic events. Unfortunately, there isn't a specific preventative measure for NBTE, as it's a secondary condition. The best approach is to aggressively manage underlying diseases such as cancer and autoimmune disorders, and to identify and treat hypercoagulable states. Early detection and treatment of these underlying conditions can potentially reduce the risk of developing NBTE. The prognosis for NBTE is generally poor, largely because it often occurs in the context of advanced and severe underlying illnesses. The prognosis is heavily dependent on the success of treating the underlying condition. Recent research is focusing on identifying novel biomarkers that could help in early detection of hypercoagulable states and on developing more targeted anticoagulant therapies with fewer bleeding risks. Further studies are also exploring the role of inflammation in the development of NBTE, which could potentially lead to new therapeutic targets. Thank you for joining us. We hope this explanation of nonbacterial thrombotic endocarditis has been informative.